This is the third of my 4 presentations, and on this one, it's always hard to figure out what's the best order to put all of this in because some things are more appropriate before others, but you can't get the order completely correct because even though we've already talked now a lot about what vitamin C can do, now I'm going to review with you what vitamin C has already been documented to do. And this is especially significant to me because even today, like with something we'll talk about this afternoon, where vitamin C along with hydrocortisone and thiamine has been put together in a protocol and has dropped the mortality rate of sepsis from 40% to 1%. And then yet you still have articles being written about this and saying that with great assertion and confidence that vitamin C has never been shown to do anything other than prevent or reverse scurvy. Now, there truly couldn't be a more profoundly asinine or arrogant thing to say, because as a nutrient and as a vitamin, vitamin C not only has obviously been shown to do a lot more, it's arguably the most researched substance when you look at the number of articles in PubMed over the last 70 to 80 years. So I want to get everybody on the same foot here, though, and review some of this information because for many people, even those who are quite familiar with vitamin C, it's pretty impressive when you put the bulk of this information in one spot to see exactly what vitamin C has done. Now, there's the same thing, so that they have references here. Again, type in that number on PubMed and hit submit, and oftentimes you can go straight to the abstract or article. And some of the older information obviously is not on PubMed, but if you take the time to type out the entire reference that's cited, you can go to some of the original articles written by Dr. Frederick Klenner. And Dr. Klenner, let me just say that I couldn't have a higher regard for Linus Pauling than I do, but none of it would have happened without Klenner. I mean, when it comes to vitamin C, Klenner is number one, okay? Dr. Pauling quite acutely and awarely appreciated and quickly realized what vitamin C could do and used his incredible fame and even notoriety to get the information about vitamin C out there, but believe me, it all started with Dr. Klenner. Dr. Klenner wrote 28 different articles, and he was the one that documented the ability of vitamin C to cure many infectious diseases and to neutralize any toxin against which it was treated. And I gotta say this, I'm still fascinated to this day that when Dr. Albert St. Georgi won the Nobel Prize in the late 30s, 37, 36, something like that, for discovering vitamin C, and a very few short years later, on his own, and I don't even know how he must have gotten together with some pharmaceutical company on his own so that they would provide him with multi-gram doses of vitamin C. I mean, he just plucked a miraculous therapy out of thin air, is what I can say for Dr. Klenner. So I rarely use the word genius, but I can't see how the word genius could not apply to Dr. Klenner. He just did absolutely something that had never been remotely suggested in any capacity to do anything of the value that vitamin C does. And to take it on the flip side, my goodness, it was pretty bold and daring to give sick patients a remedy that had never been given before. So he must have had a lot of confidence in his reasoning. Okay. So I'm not going to dwell on each one of these things. You can review the slides at a later date if you want and look at some of the references, but I just want to demonstrate for you, first of all, what has vitamin C already been proven to do. Not suggested to do, not suspected to do, but clearly proven to do. Number one, in vitro, in the test tube, it was very quickly established after its discovery that vitamin C could completely inactivate the polio virus and render it completely non-infectious. Okay? Similar activity was noted with the herpes virus. It was also documented to kill or inactivate. I say kill or inactivate because technically a virus is an inanimate ball of protein and not really a living substance. So it just depends on how you want to regard it. Let's just say it takes the virus out of commission. Whether you want to say it's killing it or inactivating it is your choice. So Yersinia viruses it knocked out. Some exotic viruses like the tobacco mosaic virus it knocked out. It even knocked out the bacteriophage viruses. And again, you can see all the different references. It inactivated enteroviruses, of course, the influenza virus, and even the rabies virus. I mean, I think even today, we sort of give this needless reverence to rabies as something that's just completely and totally uncontrollable without, of course, the precious vaccine treatment. Now, so that was viruses in the test tube. What has vitamin C already been proven to do with viruses as an acute viral illness in a person? Far and away, the most dramatic thing, at least in my humble opinion, that Dr. Klenner published was his treatment for polio. When I first ran across this information, I started crying. When you think of all the individuals that polio has not only killed, but permanently incapacitated for the rest of their freaking lives. Okay? Well, most of us are not that good at mathematics, but what does 60 out of 60 sound like? Dr. Klenner, in the middle of the polio epidemic in the United States in the late 1930s, he was an internist and a general practitioner, so he got his share of general calls to the emergency room. And in the middle of this epidemic, the little babies and children were dropping like flies from polio. Well, again, I don't know how he got the idea, but he decided that vitamin C was the way to go with this. So on the tiny babies, he gave intramuscular injections, and on the larger children, he gave intravenous injections. Now, I might also add that at least 50% of these cases of polio were documented by spinal tap, so they weren't just having some sort of other viral syndrome or nonspecific malaise. They had polio. So in 57 out of 60, he had a complete cure in 3 days. The other 3 cases required 2 more days. And even though the next thing that he did was only 1 case that he reported on, you can often learn an incredible amount of information from just 1 case. In this particular case, it was a young girl who had already had polio for 2 weeks. And she already had flaccid paralysis of her legs. I mean, flaccid just means like a piece of dead meat. There's just nothing left there, no movement, no sensation, no nothing. Well, even at this late stage, Dr. Klenner started the intensive vitamin C therapy, and it didn't happen in 3 days, it didn't happen in 5 days, but within 2 weeks, the little girl was completely cured and ambulatory. Now, there's a lot of people in this room that are younger than me, but there's a few that are as old as me or even a little older, so you remember the iron lung, where the polio would affect the respiratory muscles, and they would just sit inside this metal container so that they could continue to breathe. Dr. Klenner actually, after putting these 60 cases together, presented this information at the American Medical Association in Chicago the next year. I don't know if they threw tomatoes at him or what, but there wasn't any questions to speak of after he finished his presentation. And then the two people that followed him talked about the iron lung. And there were lots of questions to them. So I'm not here to completely analyze or understand why people do what they do or think what they think, but never let it be any doubt of what vitamin C has been proven to do. Now, not so much Dr. Klenner, although he did this a lot. Dr. Klenner liked the intramuscular and the intravenous vitamin C, but there were a number of other researchers in roughly the same time period as Dr. Klenner, who also showed that many of the syndromes that Dr. Klenner was curing with intramuscular and intravenous vitamin C could also be readily cured with much larger doses of oral vitamin C. And that in addition to curing different viral syndromes, that the vitamin C virtually always clearly showed an accelerated resolution both in total duration of the disease and intensity of the disease symptoms when a viral disease was treated with vitamin C. This always amazed me, this particular slide, because when I was an intern and later internal medicine resident at Charity Hospital in New Orleans, I saw a bunch of patients with acute hepatitis. I mean, they had the yellow eyes, they had the big enlarged liver, they had their SGO and SGPT and LDHs into the high hundreds to thousands, and they were sick. And it would have been, and probably still is, almost inconceivable to me that somebody like this could be cured by any regimen in a week, when they routinely stayed sick for 2, 3, 4 months, never really recovered completely, and often went on to a syndrome of chronic hepatitis, and sometimes to the point of needing liver transplants. Well, Klenner and also Dr. Cathcart, a United States doctor, showed that acute viral hepatitis was a snap. I mean, when you consider the severity of the infection, it's like the vitamin C liked the hepatitis more than it liked all the other syndromes. Because sometimes it takes a while for it to deal with advanced flu, but not acute hepatitis. I want to emphasize the word acute, okay? Vitamin C does a lot for chronic infections too, but definitely nothing to the same degree that it does for acute. Furthermore, Dr. Cathcart, who in California treated very many cases of acute hepatitis, and he did it most often with extremely high doses of oral. Once again, and this is something I'm going to emphasize and talk about in a little bit, is it's not so much where the vitamin C comes from, but where it goes and how well it concentrates where you want it to concentrate. So you can accomplish pretty much the same things with oral as you can with IV. It might not happen as quickly, it might not happen as dramatically, but it'll happen. And Dr. Cathcart, and he treated, I think, many hundreds, if I'm correct, of cases of viral hepatitis, and he never had a single case of viral hepatitis acute proceed to chronic. Now, for those who like formulas, Dr. Klenner outlined his dosing regimen for pretty much all acute viral syndromes. He'd give 500 to 700 milligrams of vitamin C per kilogram body weight every 8 to 12 hours. And he would also give a large dose orally. These days we have something called the multi-C protocol, and Dr. Klenner was right on board very early on and pretty much doing the same concept. I mean, there wasn't lipospheric or liposome encapsulated vitamin C available in Dr. Kletter's day, but I'm sure he'd have jumped on the bandwagon really quickly if it had been available. Maybe almost as impressive as his work with polio was he reported a number of cases of patients who had acute viral syndromes, sometimes starting in the chest, sometimes starting in the head, and they proceeded to advanced viral encephalitis to the point where the patients were already in a coma. And even at this stage of viral infection, Dr. Kletter would routinely bring them back, usually have them conscious a few hours after the first dose of vitamin C, and have them walking out of the hospital several days later. So even though, and I have a few suggested mechanisms, but even though we really still to this day don't have a good handle on exactly why vitamin C does what it does to a virus or a cell that's infected with virus, there's still no question that it does it. This, if you've never seen it, how many people have seen the New Zealand 60 Minutes video of the farmer in a coma with H1N1? Okay, but still a lot haven't seen it, okay? This, unless you don't have a heart in your body, have some tissues ready. This is something, and we might be on the threshold of things changing. I hope so. This happened back in 2010, so here we are 7 years later already. Doggone, time flies. But the family needed a legal fight to get their dying father intravenous vitamin C. It was kind of funny. A cousin of them sent me an email before all this started, and it wasn't like I played any significant role. I didn't. He just asked me, well, Dr. Levy, do you think IV vitamin C will help? And I said, well, certainly a good chance it'll help. I don't know how far gone your father is, but there's certainly a good chance it'll help. Well, that was the extent of my contribution. It's kind of like, and then I shrugged my shoulders, and although I didn't put it in the email, I said, like, that's ever going to happen. Well, every now and then you run into a family that fights. They got the IV vitamin C to this patient. This patient was already intubated in a coma and had a complete whiteout of the lungs on the x-ray. And they wanted to terminate life support and let him go. And the family said, no way. Well, they gave him the first day, I believe it was 50 grams twice a day. So he got 100 grams the first day. By the next day, less than 24 hours, the lungs were starting to clear up. And he was showing agitation at having the tube in his throat. And within 2 more days, the tube was out, and he was breathing on his own, getting better. And now, what happened at that point in time, to me, represents one of the darkest points in the history of medicine. And this is why I cut doctors no slack at all. A lot of the son of a bitches should do hard time. Here, this patient, I'll give you the facts, and you tell me if you reach the same conclusion that I reached. They gave him 50 grams twice a day, and he got to the point where the tube came out, he was getting better. And then, without telling anybody, the doctor in charge didn't discontinue the vitamin C. They decreased the vitamin C from 50 grams twice a day to 1 gram twice a day. Why would you do that? If you felt the vitamin C was worthless, you'd stop it. If you felt the vitamin C was beneficial, you'd continue it. But if you wanted the patient to die, but be able to say, but we continued the vitamin C, that's what you do. That physician should be in jail. And he should lose his license. But This is not an uncommon story. We just don't often get the details as dramatically as we have on this particular case. As it turns out, the poor son of a gun had no idea how good vitamin C is, because when the patient got decreased from 50 grams twice a day to 1 gram twice a day, he continued to get better, but much more slowly. And since the tube had now been taken out, they were able to give about 6 grams of liposome encapsulated vitamin C orally, and there was no way he was going to relapse on that. So, your doctor does not deserve your trust until he or she earns it. They don't deserve it just because they're a doctor. Sad to say, but that's my point. Now, in addition to that, what has vitamin C already been proven to do with other acute viral syndromes? It's resolved very quickly measles and mumps. And let me say, this is a good point in time to emphasize that, measles and mumps, lots of times they're inconsequential childhood diseases. Well, let me tell you, especially if the child is a little bit immunosuppressed, not on very good diet, these cases of measles and mumps can rapidly spread to the brain, and you have lots of kids, more than you hear about, that either die or get permanently incapacitated by this virus. So it's no small feat to have an agent that can quickly and acutely and promptly resolve and cure a clinical syndrome like this. Now also, herpes virus, and again, let me emphasize we're talking acute, chickenpox. Resolve it very quickly. Chronic viruses are much more difficult to deal with, and I'll talk a little bit about that in a moment. Rabies. Well, there's never been reported any cases of rabies in humans that I know of that have been treated with vitamin C. I suppose because they'd be afraid of being sued if the patient had any problems at all and was not given the precious vaccine. But, and I say precious vaccine, that is sarcasm. Okay. But they did some dramatic studies with animal studies where they infected it with rabies, and the vitamin C resolved the rabies virus just as quickly as any other virus. There still is yet to be discovered any virus at all, test tube, animal, or human, that in the stages of acute infection, vitamin C will not completely and promptly and permanently resolve. Maybe it exists, I don't know. It hasn't yet been discovered. Now, those are the viruses. Vitamin C is what I call an absolute viricide. It kills or inactivates whatever virus it deals with. With regard to bacteria and bacteria-related pathogens, it almost always resolves them. The viruses are uniquely susceptible, but the bacteria respond very well as well. So with regard to bacteria, it's often bactericidal. It will often kill the bacteria. It's virtually always bacteriostatic, meaning it might not kill the bacteria, but it'll stop it from growing. And to top the icing on the cake, it's been established in the literature that by at least 20 different mechanisms, vitamin C supports and augments and strengthens the immune system. So it helps T cells proliferate. It helps B cells that produce antibodies proliferate. It increases antibody production. It strengthens antibody response. It increases natural killer cell production. It does everything. So even when you don't think you have, it still frustrates me to a great deal how so many physicians have this air of pseudo-arrogance that they won't use something unless they think they understand it. Well, I certainly don't need that. All I need to know is if something is effective and harmless. If I know it's not hurting anybody and it's resolving the situation, we can sort out the explanations later on. Now, an example of the incredible bias in the medical literature. I mean, I had said earlier, there's some 30 to 50,000 articles in the medical literature on PubMed on vitamin C and the many things it can do. But we have collectively, by we I mean mainstream medicine, we have collectively browbeaten basic researchers into not asserting anything. You can have an article that is as profoundly and demonstrably effective, and they will not say that in the results or the conclusions. What they'll always say is, no matter how profoundly effective something is, they say, well, this study then indicates the possibility that vitamin C might be of benefit in this particular condition, but more studies and research is needed. Okay? In the New England Journal of Medicine, of all places, this blew me away when I first saw this because I was first doing the research and I didn't already know of all the incredible biases out there. But they had a series of 8 young people, I think most of them little girls, that had acute rheumatic fever. And they had the sore throat and the elevated pulse rate and all the other indices of infection. And they case reported each one of these 8 patients, started giving them vitamin C. And when you read the article, not the conclusion, but when you read the article, the oral vitamin C cured the acute rheumatic fever completely in each of those 8 cases. I said, wow, that's impressive. And then I read the conclusion and I said, what? Are they even looking at their own data? Are they even reviewing the results that they obtained themselves? But you cannot say, even if you do it, that vitamin C cures anything. And this is why, actually, in my first book on vitamin C, is Vitamin C, Infectious Diseases and Toxins Cure. Well, actually, the opposite. The primary title is Curing the Incurable. And that was intended to be provocative. But tell me this, is it not just as much a sin of omission to not acknowledge something has legitimately cured something than to avoid saying it? If the shoe fits, wear it. Now there's a whole host of other infections, non-viral. Believe it or not, low doses of vitamin C with a couple other things is very effective in malaria. You'll never hear that, but you got to go deep into the literature, but it's all there. Leprosy, typhoid fever, brucellosis, trichinosis, again, highly effective. Remember, when it comes to an infectious disease, and whether you're using vitamin C or an antibiotic or just about anything else, how quickly you get a positive clinical response has directly to do with how quickly the pathogen multiplies. So if it slowly multiplies, you're not going to get a rapid response. Even though there's hundreds, if not close to 1,000 articles in the literature on vitamin C and tuberculosis and all the wonderful things it does there, we had this recent quote-unquote discovery about a year ago where they finally said that vitamin C pretty much kills the mycobacterium and tuberculosis, but it does it slowly. Also, and we talked about this the other day, in some infections, especially if you strongly stimulate the immune system like you do with vitamin C, and you optimize hormones like thyroid and sex hormones, decrease oxidative stress so that infections can't as readily spread, lo and behold, you wall off the infection. You don't cure it, but you wall it off, and you coexist with it. And you coexist with it to the point that it doesn't impact your mortality or your morbidity at all. Okay? So that may not be as desirable as a cure, but as in terms of effectiveness. This is why, if you remember your days back in med school where they're talking about pathology of infections, why the fulminant tuberculosis that rapidly killed individuals was called miliary tuberculosis. Miliary tuberculosis just meant it was exploding. You looked at the chest x-ray, there were just little sites everywhere of tuberculosis growing rapidly, and there was no walling off. On the other hand, you see the chronic TB patient that's been taking the drugs for a long time, and the anti-tuberculosis drugs definitely work, but they don't really cure the tuberculosis. They just slow the reproduction down until the immune system reacts, and next thing you know, every little pocket of tuberculosis has a fibrotic coat around it. Just like, remember I said, you grow the fibrous coat over the pacemaker that you stick inside the patient. It's a foreign body. Well, pathogens are foreign bodies too. And if they localize in a pocket, you can have a foreign body reaction to them. And if you have a strong immune system, you can wall off the infection long before you effectively cure it. Now, as impressive as vitamin C is with infections, and I got to say it's pretty hard to be more impressive than what it's done in, say, polio, it's at least equally impressive as the ultimate antitoxin. And of course, we addressed this yesterday when we're talking about mechanisms by which toxins are pro-oxidant and vitamin C is antioxidant. And this is why vitamin C can neutralize and stop any poison so far that you can come up with. And again, this is a lot of literature research, and to my knowledge, there has never been any poison that vitamin C cannot neutralize. So, what has it actually been documented to neutralize already? No speculation needed, both in vitro in the test tube and in vivo inside the animal or inside the human being. All of the toxic elements, mercury, lead, chromium, arsenic, cadmium, nickel, vanadium, aluminum, fluorine, venoms. Now, Dr. Klenner had a case where they kept on wanting to give antivenom, and he kept wanting to give vitamin C. They were like co-managing the case. Somebody screwed up and had two consultants rather than one. Every time the kid got the antivenom, he got sick, and every time Klenner came along and gave the vitamin C, he got better. Fortunately, he was young enough with a strong enough immune system that he was able to overcome the physician abuse and finally recovered. And this was the case I mentioned too, where they gave the IV push vitamin C. The guy that was dying on Dr. Klenner's stretcher in his office had been bitten by something called a puss caterpillar. I certainly wouldn't know a puss caterpillar if I saw one, but apparently they're pretty toxic. So this fella's blood pressure was down to 60/0, and because there was venom circulating in the blood and not already deposited in the tissues, the intravenous IV push, not IV administration, but IV push, that Klenner gave quickly neutralized the poison and brought his blood pressure back up into the normal range even before the syringe was completely in. Now, for those of you who want to mess with the law and the police, vitamin C can pull you out of it a lot of times when you're drunk. But not instantaneously, so it'll just, it just might get you back on the road a few hours sooner. Now, that's not a recommendation. I'm just trying to tell you what vitamin C could do. Barbiturates. I mean, naltrexone is great, but no greater than vitamin C. Toxic mushrooms. This was very interesting to me. There are a few toxins as nasty as the toxin in the Amanita phalloides mushroom, the death cap. I mean, it nukes your liver, and if it doesn't kill you immediately, within a few weeks, you either die of liver failure or you get a liver transplant. Well, a French doctor by the name of Lang figured out what vitamin C could do with toxic mushroom poisoning. And apparently, I guess, he must have treated enough patients that he had a high degree of confidence in what it could do. Now, when I use the term crazy Frenchman, I'm not really trying to disparage all of the French. But he would give clinical presentations, or lectures, presentations, kind of like I'm doing now. And then in front of the audience, he would take 3 times the known fatal dose of these mushrooms. And then apply his remedy, and apparently it worked. There's a lot of stuff I'm supremely confident with, but I'm not going to give myself a fatal dose of anything just to prove to you it works. Pesticides. This was an interesting little story / anecdote where 3 little boys of roughly the same age. Now, I don't know if they ever did this in the Philippines, but when I was growing up as a kid in southern Mississippi, the mosquitoes were so intense. In the afternoon after a rainy week, you'd walk outside and it was like you're being invaded. You would see not just mosquitoes, you'd see a black ball of mosquitoes moving as a ball down the street. And I mean, I suspect if you hung around, you could have been bit to death. But anyway, they had these, it's kind of funny in retrospect because you're young and stupid and your parents don't know any of this stuff either. So they'd have the trucks going around blowing a plume of pesticides beside the truck to knock out the mosquitoes in the neighborhood. And I guess they made it so that it wasn't too inoffensive smelling because we'd run behind the trucks. Well, similarly, in North Carolina, they do the same thing with crop duster airplanes. Bring them down low, blow out a ton of pesticides, and do the crops. And I suppose the kids then were just as stupid as we were in southern Mississippi, and they liked playing underneath where the planes would come over. So these planes came over one day and dropped an exceptionally large dose of pesticides directly on these 3 kids, about 7 or 8 years old. Well, they immediately, if you will, turned themselves into a study because they all 3 got hospitalized, and they all had 3 different doctors. One of them was Dr. Kletter. Well, you could probably anticipate the outcome of this story, but Dr. Kletter immediately recognized what was going on, gave his child large doses of vitamin C, and kid felt fine, went home the next day. The other 2 were given, what do you give? Fluids, support. That's what the other 2 kids got, and they died. Even nasty things like strychnine and tetanus. Dr. Kletter also co-managed the patient that had tetanus. And I mean, when you really have tetanus, it's one of the scariest things you can see. I mean, it's like every muscle in your body is turning into a knot. Lockjaw. Just, you can't move the jaw, and you can't move a lot of other muscles either. Well, just like snake venom, they have the anti-tetanus antivenoms, antitoxins. And if it wasn't for Kletter, the kid would have probably died, but the other physician continued to give the antitoxin. And even though it would relieve the muscle spasm a little bit, the kid would get intensely ill every time he had it. And so finally, Kletter showed up enough and gave up enough vitamin C that the whole thing resolved anyway. Now, looking at chronic infections, I can't use the term as readily with the acute illnesses, namely cure, but I can tell you the vitamin C always makes them better, always reduces symptoms, shortens the total duration of the illness, and sometimes cures the chronic infection. Now, with Lyme, AIDS, and chronic hepatitis, All three of these infections are what I call infections that deal with embedded pathogens, okay? A regular acute infection, it's circulating in the blood, it's in the extracellular fluid, maybe it's starting to gain access to the intracellular compartment. But it hasn't been going on that long, so it hasn't penetrated that deeply. Well, in these three diseases, I mean, they've identified pathogens, for lack of a better word, I would say deep into the tissues, in the mitochondria, in the nucleus, even in the DNA. And vitamin C and nothing else is magic, okay? In order for it to donate an electron, it has to have access to the pathogen, access to the biomolecule. And if it doesn't, it might benefit, but it'll only benefit by indirect mechanisms, like the nonspecific stimulation of the immune system. So this oftentimes is why you don't get the immediate dramatic effect that you get with an acute infection, but you see clear benefits start days and weeks later because you're juicing up the immune system. The common cold, extremely good. Tuberculosis, as I mentioned. Pertussis is a particularly scary disease for the parent with a young infant listening to the high-pitched wheezing and wondering if the baby's going to be able to take another breath. But vitamin C is especially good for this. Why would you think that? It's infection and toxin, okay? And the baby's suffering from both. And so it's an infection and toxin, and you're using the ultimate antitoxin and anti-infection agent. Now, although we'll cover it in a little bit, I want to quickly emphasize right now, I am not antibiotic, okay? Don't think for a second that you shouldn't give an antibiotic that's indicated on a given infection, all right? That's just plain mean, okay? They work, and they work well, but vitamin C makes them work even better, okay? As I like to say, pardon my French, mainstream medicine has a little bit of good stuff and a lot of garbage. Alternative medicine, God, I hate that word, has a lot of good stuff and a little bit of garbage. But make no doubt about it, they both have garbage and they both have good stuff. So just don't go blindly crazy and reject everything that's mainstream and simultaneously embrace everything that's alternative, because you're not going to do your patients any favors with that either. Dr. Yanagisawa went over this. I won't spend much time except to say radiation poisoning is nothing more than a mechanical versus a particular physical agent, a mechanical induced oxidation. So radiation does its damage like any other toxin does its damage by causing or resulting in extreme and rapid and advanced oxidation of biomolecules. And the only time you won't have a positive effect of vitamin C and other antioxidants with radiation poisoning is when it was so overwhelming, too much stuff got oxidized before you got a chance to deal with it. They did some very good clinical studies on animals that you can take a look at. And this was directly from Dr. Yanagisawa's work. Now, there's a lot of information out there on vitamin C and these other conditions, and even though I'm just going to touch on them lightly, doesn't mean there's not a mountain more of evidence than what I'm showing you. Vitamin C exerts anti-cancer activity, both in the test tube and in the body. And actually, if you go to the Reardon Clinic website, it's reardonclinic.org, R-I-O-R-D-A-N, reardonclinic.org, where Dr. Honeyhackey, we give a lot of presentations together, and we've developed a lot of protocols together. They have a mountain of their own research on vitamin C and cancer, and full-length articles where you can get a lot of information on that. Oh, I just scooped myself. Well, there's the link. RiordanClinic.org, research articles. And when you look at vitamin C in cancer, really any chronic degenerative disease, this is not a rocket science result that should be unexpected. Any advanced chronic degenerative disease, like we talked about yesterday, is caused by large amounts of increased oxidative stress. Okay? Increased oxidative stress consumes vitamin C and antioxidants. So the worse your disease is, the lower your plasma levels of vitamin C are going to be. Similarly, using pretty much the same reasoning, they've done some very nice studies. You know, there's a lot of studies out there where they're trying to look at vitamin C, or they're looking at this vitamin or that nutrient or blah, blah, blah. And they're doing surveys on what the diet is and what they're supplementing. That's pretty soft science. I mean, you can really play with things and manipulate them and get pretty much whatever result you want. But when you start looking at blood levels, not so easy to manipulate. So in looking at blood levels of vitamin C, it was very clear that the highest plasma levels of vitamin C are associated with the least mortality from heart disease. And that compared to the top quartile with the lowest quartile, half the chance of dying. Same thing here, similar approach. And then another chronic degenerative disease. The higher your blood levels of vitamin C, the lower your chance is of developing diabetes or any other chronic degenerative disease. It's just that a study just generally looks at one thing. It doesn't mean that other things aren't equally affected. It's just that another large study needs to be done to do that one. Okay, now dealing with the fiction. And boy, is there a lot of it out there. It's sadly amazing and incredible how to this day, like it's a brand new discovery, every few months another mainstream scientific press article comes out there about, oh my God, guess what? Supplements don't help you, and if there's vitamin C in it, you're going to get kidney stones. I think it's very clear, both in medicine and politics, that if you don't think bold-faced lying is common, you're in a state of delusion. Okay? Now, there's just about everything has a toxic dosage. I mean, they do a lot of animal studies where they do things called the LD50, which means you give enough of whatever this substance is until half the animals die. Lethal dose 50%, LD50. And like I said, you can push it to that on just about everything. Well, guess what? Of all the substances out there, vitamin C has no defined toxic dosage. Zero. And there's some articles that go over this very dramatically. In a little school in the northeast of the United States, Harvard, okay. They did a very nice study that showed, well, on a small number of people, only 85,000 women. Sorry for my sarcasm. No incidence increased of kidney stones with taking vitamin C. And then they took it a step further. Another Harvard study. The members that had the highest vitamin C intake had the lowest risk of vitamin C. Now there's a flip-flop for you. And remember, because once again, somebody emailed me the other day and said, Dr. Levy, I know what you think about vitamin C toxicity, the kidneys and everything, but what do you think about this new study? And they had something that said, oh, again, vitamin C increases your chance of kidney stones. Well, when you looked at the article, you realized they made no effort to discern patients that were taking large amounts of calcium. Your most common kidney stone is calcium oxalate. Now, vitamin C and many, many, many other things will metabolize down to oxalate. But an increased oxalate level by itself is not a risk factor for stone disease. As a matter of fact, pregnant women routinely have supersaturated levels of oxalate in their urine. But you don't hear pregnant women getting kidney stones. Okay? But when you throw in the cation, calcium, to go with the anion, yeah, it's just biochemistry. You supersaturate your urine with calcium and oxalate, you're going to get stones. Okay. So, again, higher vitamin C levels, lower incidence of stones. And in my book, Curing the Incurable, I decided I'd go into the literature and see what else increased this horrible thing called oxalate in your urine. And I finally got bored after running into 55 different things. So, now, question. How many of you think water is poisonous? Well, we certainly don't regard water as poisonous. We consider it pretty much to be good for us. You can routinely and reliably and predictably drink enough water to kill yourself. Now, death, that's a pretty dramatic toxic effect, don't you think? You can't take enough vitamin C to kill yourself. You can't even take enough vitamin C to make yourself sick. Okay? So if you're just looking at the dramatic endpoint of death as a side effect, not even nausea, upset, a virus, headaches, death, water is vastly more toxic than vitamin C. So everything needs to be taken in balance, and you need to look at the big picture. I'm going to address these next couple slides in a little more detail in the second presentation this afternoon because of some of the recent events that have occurred with the vitamin C and sepsis scenario, which I think you all should be keenly aware of because this is information that could be used and manipulated to your advantage and to the benefit of finally getting vitamin C out there. But with vitamin C or any other therapy, there are three critical medico-legal factors. One is its cost. Okay, you can have something of inconsequential cost, or you can have something of huge cost and limited availability, like a heart transplant, where due to availability and cost, you can't give it to everybody. Okay, so there's availability and cost. Number two, is it experimental or unproven? Or is it proven by 50,000 different articles? And number three, is there a substantial risk of severe side effects? Or is it the safest agent known to mankind? So in the case of vitamin C, it's not prohibitively expensive. Hey, you could even call it cheap. It's very well established to be effective. And being generous, you can even use the words that it's not prohibitively toxic, although I would submit to you it's not toxic at all. So, now we'll move a little bit on and we'll talk about some of the practical considerations about vitamin C. I mentioned already it significantly, number one, enhances immune function. And in Curing the Incurable, there's the research that shows you how each one of these different 20 effects on the immune system are reflected in the literature. Vitamin C has its own direct anti-pathogen properties. It's called the Fenton reaction. Inside cancer cells and inside pathogens. Yeah, you can effectively, biochemically, think of a pathogen as a cancer cell because they have pretty much the same intracellular chemistry going on. that intracellular chemistry is a huge accumulation of iron. Cancer cells and pathogens both feed on iron. Many antibiotics are effective because they're iron chelators, and they basically take away or hold away the fuel upon which cancer cells and pathogens proliferate. Matter of fact, I found it very curious, but as physicians, even though we seem to still prescribe antibiotics when somebody's got a bad cold, even though we think it's just a virus, and they say, well, don't prescribe antibiotics for a virus. That's inappropriate. Maybe, maybe not. Some antibiotics chelate iron. And if you chelate iron, you're going to prevent a virus from proliferating. Combined with the fact that if you don't get on top of a cold really quick, it'll rapidly evolve into a bacterial infection. So I say if the antibiotic's available, take it. Vitamin C, of course, in addition to the anti-pathogen properties, neutralizes all the associated toxins. Oh, and let me tell you a little bit more about the Fenton reaction. What happens in the Fenton reaction is you have iron inside your cell and you have hydrogen peroxide inside your cell. And in the case of cancer cells, for reasons I don't understand, you have depressed to absent levels of catalase, which is designed to break down hydrogen peroxide normally. So when you have absent to low levels of catalase, you have high levels, relatively high levels, of hydrogen peroxide inside your cells, inside your cancer cells. I already told you the cancer cells feed on iron, so you have two things going on inside a cancer cell. You have increased levels of iron, and you have increased levels of peroxide. Well, when you donate an electron to peroxide, you break it down into the most oxidating agent known to man, which is hydroxyl radical, and it so quickly oxidizes anything that's around it, it won't even migrate. As soon as it forms, it oxidizes whatever it's close to, which is as toxic as you could possibly get. The thing is that you need ferrous 2+ to donate the electron. When you have ferrous 3+, which is the oxidized form of iron, it won't donate that electron to peroxide. So, when you have an agent like vitamin C come along, it comes inside the cell, it donates its electron to Fe3+ and turns it into Fe2+, and now you have the natural agent that can give that electron to peroxide and cause the hydroxyl radical to form. So it's all a question of access. Even though the vitamin C still is doing one thing, it's donating electrons, it's resulting in a profound pro-oxidant effect by the production of the hydroxyl radical. And when you do a lot of that, you will rapidly upregulate the oxidative stress inside the cell and rupture the cancer cell or make it go into an apoptotic state. And now number 4, and this is an angle that I want you to concentrate on because I'm going to talk about it this afternoon. And it's extremely important to remember this, and it's extremely important to realize that in getting vitamin C available to hospitals and patients, we're dealing with some profoundly stupid and power-controlled individuals. Profoundly stupid, profoundly interested in controlling other people at all cost. So, don't beat your head against a brick wall. You're not going to have a rational discussion with an oncologist about treating cancer or with a pediatrician about vaccinations. It's not going to occur. So in the case of vitamin C, you need to take a different approach. And I can't say it'll work for sure, but I'm pretty sure it will if you remember these principles. All infections consume vitamin C, and they consume it rapidly and they consume it profoundly. Okay? Now, especially in the case of septic patients, this study I'm going to tell you about this afternoon, they looked at vitamin C levels in these septic patients. Not surprisingly, not only were they profoundly low, but in most of the patients, there was no vitamin C left that was detectable in the plasma. So, ergo, Don't come running into the ICU and say, we got to give this patient vitamin C to kill their cancer, kill their infection, do all sorts of magical things to their immune system, whatever. What you do is you measure plasma vitamin C levels. And when they come back low, you say, well, we have an identified deficiency of vitamin C in the blood. We need to give vitamin C to as best restore that deficiency as possible. And don't be putting in the progress notes that it's good for the immune system or it's going to kill pathogens or anything. Just going to say, patient has evidence of decreased levels of vitamin C, need to give vitamin C to help restore that deficiency, and that's it. Don't go and try to hammer anybody over the head with the truth that they don't want to hear. I mentioned this earlier, prominent promoters of chronic disease, infections, outside toxin exposures, toxic iron, calcium, and copper status, dietary toxin exposures, and hormone imbalances. And that's the foundation for these treatment principles: prevent the daily toxins, neutralize existing toxins, excrete existing toxins, resolve infections, supplement optimally, not always a straightforward thing, and address hormone imbalances. All right, so now let's go into some more specifics on vitamin C therapy. I think I made it clear so far that vitamin C is wonderful, but don't use it as a monotherapy. Use all your other good things too, but let a vigorous administration of vitamin C be your foundational intervention. So, start with the concept. The concept of a vitamin C-centered protocol is to get optimal concentrations of vitamin C as is possible in every compartment of the body. I call it, you try to approach as best as possible or reach a ascorbate saturation. And this should always be the goal. Now, sometimes, lesser infection, lesser disease, you take your favorite form of vitamin C and you push the dose up very high, and you get complete resolution of your condition. Well, that's fine. That's not somebody you need to push ascorbate saturation on. But conversely, if pushing that one form of vitamin C to its highest dose possible does not get you the result that you want, don't think the vitamin C has yet failed you, because there's a lot of different things that you can do and a lot of different manipulations. What are the main factors in the effective administration of vitamin C? Dose. Dose is the first on the list, and it's also the most important one. What do they say are the three most important factors in real estate? Location, location, and location. What are the three most important factors in French cooking? Butter, butter, and butter. What are the three most important factors in vitamin C therapy? Dose, dose, and dose. So, you use a little bit, don't be disappointed if it has no effect at all. And don't think that that even remotely indicates that more will not do the trick. Remember, everybody has a different redox balance in their body. So 2 grams might completely clear somebody up, one person, and it won't even touch another person. Okay? Very informally, I came to the conclusion some time back because I read a lot of Dr. Klenner's work, and although I never had remotely the opportunity to treat the spectrum of disorders that he treated, there were enough different things that I treated where it always appeared to me that I needed 20 to 30% more vitamin C than Klenner often used to get the same result. Well, what's happened in the last 60 years? Everybody has a ton more toxins or pro-oxidant factors in their body. So your vitamin C needs to overcome that toxicity before it can start to dent the infection or whatever other disease you're treating. Just another statement as to the pathetic state of our environmental toxin exposure, water, food, and air. So you have that factor dose, you have route, lots of different routes available, rate, you can give it extremely rapidly, moderately rapidly, or desperately slowly. How often do you give it? How long is the total duration of the protocol for an acute illness? What type do you use? What other therapies optimize it best that you take along with it, adjunct therapies? Safety, we've sort of addressed that in the overall protocol. Now, I know everybody likes formulas and they like to really be precise, so I'm going to repeat, don't try to be so precise with vitamin C. You take what you administer what you need to get the result you're looking for. I already told you it's the safest substance known to man. So don't get all upset about taking 100 grams rather than 10 grams. Okay? Now, as a very small rule of thumb, most of the time with intravenous preparations, you're going to be given 25 grams to a small body, 50 grams to a larger small body or a small woman, 75 grams to a moderately sized man, and then 100 to 150 grams for a big man. Now just think about it in terms of generally 50 grams is your good dose to use on most people, but remember, if you use 50 grams on a 90-pound woman, that's vastly more vitamin C than giving 50 grams to a 250-pound man. Okay, so don't think you've made an equivalent treatment when you've treated a 250-pound man with 50 grams of vitamin C for his acute illness as you just gave to the 90-pound woman. You can give 50 grams to the 90-pound woman, but just remember, it's a heck of a lot more than the same amount to a 250-pound man. Route and form. Intravenously, you either need sodium ascorbate or you need buffered ascorbic acid. Ascorbic acid is pretty nasty, burns quite a bit if you don't get the pH right. The ascorbic acid vials that you can get commercially, those are buffered, okay? And if you read it, it says it's got sodium bicarbonate added to it. That doesn't mean that the IV might still be a little bit better if you add a few more cc's of sodium bicarb to it. That's perfectly fine. Then use your pH paper to see if you're getting close to a pH of 7. You can still get away with a pH of 5.5 or 6, but if you have an extremely sensitive patient, tiny veins, they just are the ones that complain about everything and nothing makes them feel comfortable, buffer that solution on up to 7. Something that never got used a lot since Dr. Klenner, but I'm finding with some of the docs that I've worked with, it's highly effective, and it's highly effective at substantially lower doses than intravenous, and that's intramuscular. Just like Dr. Klenner did with his polio babies, giving them 1 or 2 grams in the rump each side, and he would then use compressed ice to minimize the pain. Remember, that's still available today. And just a moment. Okay. I don't have it here, but these days you can add a little Procaine, but you can still pretty much get as much as 2 grams into each gluteus, so you can get 4 grams at a time. And just deducting about this, you give something intravenously, you get a very high plasma level, and you get a very rapid excretion. So you have a big positive and a big negative there. When you give intramuscular, you get a nice slow release that just continues, sort of like if your liver were making it, like the other animals. So utilize all these different factors and try to remember them when you're constructing your own unique approach to a given patient. Now they have liposome encapsulated vitamin C. I've been a consultant to a liposome company for about 11 years in the United States, Levy Labs. And I'm not trying to paint myself as some sort of wonderful person, but I only became affiliated with them after I realized what a profoundly positive product this is. As a matter of fact, I'll give you a little story. 11 years ago, I had just closed my clinical office in Colorado Springs where I'd give some vitamin C IVs, etc., meaning I no longer had IV vitamin C available to myself as well. And Levy Labs went online and they saw that I'd written about vitamin C and they said, oh, this looks like a guy that we could work with. And they talked to me on the phone and told me all about liposomes, which I'd never heard of in my life. And finally, just to get them off the phone, I said, okay, fine, send me some. So they send me a box of it and I throw it on the floor and go about my life for the next month or so. And then, boy, do I get a case of the flu. I mean, sick as the proverbial dog. Well, I still had vitamin C powder. Didn't have any IV, so I dosed up my powder until I was excreting like the proverbial goose. I mean, it was in one and out the other. And I didn't feel a bit better. I remembered one thing and one thing only that they told me on the phone back then is this vitamin C, because of the way it's absorbed, has no bowel effect. I said, wow, I guess that means I can take a little bit of this and not have further diarrhea and get my vitamin C level up. So I took 5 packets, it's 5 grams. And incidentally, this story has made its way onto the internet, so whenever you see anything about liposomes, somebody's going to be writing about it, they're going to be pretending like they discovered this. It all came back from this first story I'm telling you right now. So things sort of grow on the internet. So I took 5 grams of it, and an hour later, I felt so much better than I had ever felt when I got a 50-gram infusion when I was sick. And then I took more and rapidly resolved my little illness. Well, so I thought about that a while, and I said, wow, 5 grams orally, 50 grams intravenously. So I did the only logical thing at that point in time. I said, this is impossible, I'm going to ignore it. And it had to repeat that scenario once more with myself and a couple times with family and friends, and saw pretty much the same result when I said, okay, Dr. Idiot. It's about time you actually crack a book and figure out what a liposome is and how on earth a tiny dose of something orally can have the same or better effect than a much larger dose intravenously, which is exactly what happened. So you'll see stuff out there that says liposome encapsulated vitamin C is 5 to 10-fold more potent than IV. All I can say is that was the case at this time for this acute viral infection. That doesn't mean liposome encapsulated C is always superior to IV C, but remember what I said, the more and the different forms you can take, the better. So probably if I had only one option available to me, I'd take the liposome C, but I don't need to make that decision because I can take as many forms of vitamin C as I want when I'm sick. And that's what I'll do if I have that option. So the liposomes are very tiny, 100 to 200 nanometer spheres, and they look like artificial cells. They're very rapidly absorbed. Virtually none ever reaches your colon, so you don't get a C flush with it. You have no stomach upset with it because the payload is protected from the stomach, and the stomach is protected from the payload. So it works both ways. And you have intracellular bioavailability. But you have intracellular bioavailability without the consumption of energy. When you take vitamin C intravenously, the vitamin C that is reduced, not oxidized, in order to get inside the cell needs an active transport mechanism. So you need to consume energy to get an energy-producing substance inside the cell, robbing Peter to pay Paul. The vitamin C that you put into your blood that gets oxidized, the dehydroascorbic acid, that passes into the cell because it's non-ionic, no energy consumption, but it's already oxidized. So in order to get it back to reduced vitamin C, you need to consume energy to reduce the oxidized hydroascorbic acid back to active vitamin C. So even though you put it directly into your blood, you have to consume energy to get the vitamin C inside the cell in the form that you want it. When you take it in form of liposomes, even though you take it orally rather than intravenously in these tiny lipid nanoparticles, you get almost complete absorption. You go straight into the lymphatics, not the portal circulation. You go into the lymphatics, into the ileals. You supersaturate the immune cells, and then you go into the lymphatic system and get dumped into the thoracic duct and into the blood. And once it's in the blood, you go inside the cell without the consumption of energy. You either have a reverse pinocytosis that merges and dumps the contents inside the cell, or you pass directly through some of the larger pores in the cell wall and do the same thing with the mitochondria or the nuclei. So you can actually get a deep penetration of the vitamin C inside the cells and the cellular organelles without the consumption of energy. That's the biggie. Also, aside from all of this stuff about vitamin C or whatever else you have side of the liposome, if it's a quality liposome, you have what's called phosphatidylcholine, which is one of the primary constituents of the cell walls in your body, in your natural cells. And those have antioxidant value, anti-atherosclerotic, cholesterol lowering, etc. How did the liposomes come about? Very interesting, because I don't know how much this guy knew what was going to happen before he did it, but he found that the right type of phospholipids dropped into the water. They rapidly balled up into a ball and encapsulated what was already dissolved inside the water. There you have your liposome. And early on, and this is very important to put the liposomes in perspective as increasingly useful therapeutic agents as time goes on, is what happens if you take insulin by mouth? It's a huge protein. You just chop it up, digest it like you digest any other protein, and you have no absorption at all of intact insulin and no hypoglycemic effect. When you take insulin, which is an especially large protein, it's not a peptide, it's a huge protein, and encapsulate it in liposomes, you can show glucose-lowering effects in rats. So liposome-encapsulated insulin can deliver the insulin inside your body without breaking down. And so this demonstrates, as dramatically as possible, the ability of liposomes to transport different large molecules that would otherwise be completely broken down and digested if they weren't encapsulated. So, important to understand, like I said, that the phosphatidylcholine is what naturally makes up the cell wall. And when liposomes were first discovered and produced, they were produced with the idea of wanting to do laboratory studies on experimental equivalents of cells. And now here, you see it's a bilayer, okay? You have these lipid molecules, the phosphatidylcholine, where you have the water-soluble heads on the outside and on the inside, and you have the lipid-soluble tails inside the membrane. And incredibly enough, this is the precise structure of most of the cells in your body. So as it turns out, liposomes are just one of the ways in which the body naturally transports stuff from point A to point B. I mean, did you ever wonder why you could have pathology in one part of your body, and shortly thereafter you could have evidence that there are other parts of the body that know about it? It's by these type of transport mechanisms. Here's an electron micrograph. You can see the core, the payload, and you can see the bilipid membrane. So, the reason why these work so well is because in intracellular communication you have naturally occurring substances called extracellular vesicles. And they're constructed in their outer layer, just like a liposome, just like a cell. You got to remember, when you're inside a cell and you start to break materials down and they get pushed out of the cell, as they get pushed out of the cell, they acquire the same cell wall as is on the outside of the cell. So they actually become little satellite cells, if you will. And there's four main extracellular vesicles: exosomes, microvesicles, apoptotic bodies, and liposomes. And the only differences in all of these is size. Just size. Exosomes, these are kind of tiny. They're 40 to 100 nanometers in diameter, okay? And in our less sophisticated day, when these were first discovered, the scientists called them intracellular garbage cans. You produce some products and you'd ball them up and it'd be a way your body of getting rid of it. Well, since then, we know they're not so much garbage cans as they help communicate between cells, okay? And they've been found to be secreted by many cell types, present in sperm, urine, plasma, bronchial lavage fluid, colostrum. Microvesicles, pretty much the same thing, but they're the size of a small liposome to a very, very large liposome, 100 to 1,000 nanometers in diameter. And you have intracellular organelles known as lysosomes inside your cell. And this is one of the ways that allows, and this is garbage as far as we know, for the contents of those liposomes to finally be expelled from the cells and not contaminate them. Apoptotic bodies, well, when you have cells that die and they start to condense and they're no longer viable, but they just encapsulate the debris that's inside the cell, you basically take a large cell, contract it down, and make a microvesicle. And then finally, liposomes. It's unclear whether liposomes occur in nature or they're just man-made, but we know from the other vesicles that I just mentioned that they serve the same function. Now, another factor in the administration of vitamin C that can give you lots of different scenarios is the rate at which you give the vitamin C. As we've seen in the examples, if the patient is supercritically ill and might die in the next 10 minutes, you want to give it as quick as possible. If you have more time to play with than that, then you can decide whether you want to give it rapidly, moderately, or slowly. And this is the direct quote that Klenner put in his article. Let me read it for you. In a cyanotic, acutely poisoned patient who felt he was dying, Klenner wrote the following: 12 grams of vitamin C was quickly pulled into a 50 cc syringe with a 20-gauge needle, was given intravenously as fast as the plunger could be pushed. Even before the injection was completed, the patient exclaimed, "Thank God." Now, rate can cause some funny things to happen. They can be good things, but if you're not aware of what's going on, you can enter panic mode and not be sure what's happening. Vitamin C is very, very close to glucose. I mentioned this before. When you give a large dose of vitamin C quickly, just like the proverbial glucose tolerance test, the body thinks it's got a ton of glucose and it secretes a large amount of insulin to metabolize that glucose. Result being is a rapid push of vitamin C inside the cell. a rapid metabolism of the circulating glucose, and significant and oftentimes profound hypoglycemia, as low as 20 milligram per cc we were able to measure in some of our patients. However, unlike insulin potentiation therapy, when you're driving the glucose low with insulin, there's not a large circulating load of vitamin C to compensate. When you drive the glucose low with endogenously secreted insulin, and at the same time you have a super high level of vitamin C in the blood, you have a protected hypoglycemia because the cells can now take up vitamin C rather than glucose. Not the same situation as losing access to the glucose and not having anything to compensate for it. Frequency. This is pretty much the case with infections, all right? If you have somebody with an acute infectious disease and you give a large dose of vitamin C and they don't get any better, you don't waste any time. You give another large dose of vitamin C. On the other hand, if long before that first infusion is complete, they're breathing easier, the fever's coming down, they're not perspiring, they're saying, my God, I feel better, well, okay, then you can start spreading out the dosing. So frequency is pretty much just a parameter that you use with acute infectious diseases, and you use your clinical ability to decide whether or not you're getting rapidly enough the clinical response that you want. Duration. Boy, has this been a hard lesson for me to learn. So please listen carefully and take advantage of the hard lessons that I've learned without making the same mistakes yourself. When you're dealing with an acute infectious disease, frequently a virus, and you're getting a very quick and profound response to your vitamin C, and then you reach a point where, in your clinical estimation, the infection is 100% resolved and the patient is 100% normal, don't stop the IV vitamin C. Continue the same, not mild doses, but high doses that got you to that point for at least 24 and preferably 48 hours more, or you will relapse. And for reasons not apparent to me, the relapse is much more vicious and resistant than the initial disease. This works with animals too, and you also get burned with animals too. Bought my wife a little, or maybe I bought it for myself, I don't know, a little min pin, 1/3 pound. It didn't even weigh a pound. Stuck it in my little pocket. Well, we brought the little puppy home. Seemed healthy when we got it, but I put it on the floor in this little bed and went over to my computer, and then outside the corner of my eye, I saw the little puppy just splayed out on the floor like it was dead. And it was just about dead. And I said, well, my goodness. I actually had the liposome vitamin C with me. So I got a little syringe, put about 2 cc's of milk in it, and then put another cc of the liposome in it. And they don't dissolve, it just makes a slurry. But I'm not a veterinarian, but I know pretty much now with at least dogs and most other animals, the last thing to disappear before death is the swallowing reflex. So you just pry the mouth open, give a little bit, you see a reflex swallowing, give a little bit more, and so I gave a 1/3 pound puppy a full gram of liposome encapsulated vitamin C. So remember what 5 grams did for this 200-pound person. And I gave 1 gram to 1/3 pound. So that would have been like me taking 250, 300 packets, I suppose. And I was sad, but I knew there was nothing else I could do, so I just went back, started working on my computer. And then out the corner of my eye, I saw a little movement. And the puppy was on all fours, walked across the room, took a little pee, took a little poo, and I said, all right, we did it. And then what did I do? Nothing. I didn't follow up with more vitamin C, and an hour later, back to being flaccid and then dead. But it was very clear to me that if I had just gone on with some maintenance vitamin C, we'd have had a complete resolution. I mean, think about it physiologically. If the little animal responded from being near dead to ambulatory and having excretory function, there's no reason that it wouldn't have recovered completely with more vitamin C. Type of vitamin C just varies depending on the cation. Hydrogen ascorbate, ascorbic acid, sodium, calcium, magnesium, potassium, manganese, zinc, molybdenum, chromium, and others. Now, let me just say, I don't know if it bothers any of you out there, and if you do, I wrote an article on this on my website, peakenergy.com, where I think it's called The Marketing Myth of, what do they call it? Food form vitamin C, okay? We have a group of docs out there, and I don't know if they're this profoundly stupid or they're just trying to carve themselves a niche, because just as in politics as in medicine, you have people that try to make a name for themselves by saying something so flagrantly ridiculous and outlandish, nobody considers that it could be a lie, so they say, what does this person know that we don't know? And what you're going to see a large group of docs saying, and they have videos on YouTube about pee and stuff and all, and they say there's a food form of vitamin C, and vitamin C is not ascorbic acid. Ascorbic acid is not vitamin C. Well, I'll start by saying that's as profoundly and asinine a statement as can be made. Now, if you take other quality antioxidants with vitamin C, will that help things out? Sure. The more you can supplement the antioxidant matrix in your body, the better. Vitamin C is just the king of the hill, okay? But it's not the only person that climbs the hill. They'll go into long, convoluted explanations as to not only how ascorbic acid is not vitamin C, but ascorbic acid can't reverse the scurvy. Ascorbic acid can't do anything good by itself. Well, 2 points I would make, and then we'll move along, is Albert St. George discovered ascorbic acid. Dr. Klenner used ascorbic acid. Dr. Klenner cured every infection in the book with ascorbic acid and nothing else, okay? Animals that make vitamin C from their liver don't make vitamin C complex. They don't make vitamin C come out of their liver with all sort of bioflavonoids and other things associated with it. They just excrete ascorbic acid into the blood. So, point being is, there's different types. They all have different qualities, but if you just see this, don't get all upset that somebody's having some sort of brilliant insight. You know, they're just having a profound moment of money-making stupidity. Ascorbic acid, good. Sodium ascorbate, some people worry about sodium overload, okay? Well, you'll see the two references there, and you can go to them. And cardiology needs, again, to look at its own literature along with internal medicine, because sodium does not cause volume expansion. Sodium chloride does. And these papers show very elegantly that sodium, when it's associated with ascorbate, with bicarbonate, with other anions, it does not have the volume expanding property that would provoke heart failure and increase blood pressure. So when you're dealing with somebody with heart failure in the ICU or in the hospital and you want to order a diet for them, technically you shouldn't say a sodium-restricted diet, although that's what it works out to be. You should say a sodium chloride-restricted diet, because sodium ascorbate, even if you take many, many, many grams of it, is not going to have a negative effect on these people. Calcium ascorbate, I hope we put that one to bed yesterday. Okay, calcium from any form. And one thing I want to say, because like Dr. Yanagisawa had his calcium up there are circumstances under which the acute short-term administration of calcium has benefits. So I mean, just taking some calcium and an occasional IV is not the same thing as drinking 3 glasses of milk a day and taking 3 or 4 calcium supplements. Apples and oranges. I mean, calcium has a lot of good qualities, but taken the way we generally take it, it's toxic. A point about the other ascorbates. Potassium ascorbate, they have some studies that show for some reason potassium ascorbate has some uniquely potent positive therapeutic capacities. I'm not sure why, but the only thing I would say about this is, nevertheless, don't use potassium ascorbate. Why? Because even though if you gave it to 1,000 docs and 999 used it right, you'd have one more doc that took 20 times more potassium ascorbate than should be taken, and the patient's dead. Okay? The wrong amount of potassium will kill you in a second. So steer clear of potassium ascorbate. And that's also why the mineral ascorbate. You know, things like magnesium ascorbate and all these are fine and good, but they do two things. One is they make the form of ascorbate needlessly expensive. And generally, magnesium wasn't a good example because you should take as much of that as you can. But manganese or molybdenum ascorbate or chromium ascorbate, if you take the amount of ascorbate you should take with those cations, you're going to overdose on them. I mean, very easy to overdose on different minerals. So selectively supplement your minerals and take your ascorbate as ascorbic acid or sodium ascorbate to the amounts that you feel are indicated. There's all this stuff about chemotherapy. I should probably update this slide now because we have like 4 or 5 really nice articles that show not only does vitamin C not hurt chemotherapy, it makes it vastly more effective. It makes it vastly less symptomatic. And it is interesting because this question now that keeps coming up has come up because it appears the oncologists pay more attention to us than we think. Because, I mean, 7 or 8 years ago, I never heard about any of this. Now, you have oncologists, not just alternative docs, saying, oh my God, vitamin C is going to neutralize the chemotherapy. Like, that would be wonderful. Vitamin C is going to neutralize the chemotherapy. You can't take vitamin C or any other good nutrient with your highly toxic chemotherapy. Well, if you're really pro-chemotherapy and you don't want to dent the impact of the cancer-killing capacity of the chemotherapy at all you need to do is stagger the administration by a few hours. Not days, not weeks, a few hours, okay? Chemotherapy doesn't circulate in the blood all day, okay? You take it orally, intravenously, intramuscularly. It's in the cells, maximum of a few hours. And then you take your vitamin C, which then does 2 things. It further increases the oxidative stress inside the cancer cells and helps the chemotherapy kill the cancer cell, while at the same time strengthening the normal cells and repairing the damage that the chemotherapy did to the normal cells. So all good, nothing bad. The only thing better would be avoiding the chemotherapy completely. But for those of you who want to use it, just don't think for a second that you're unable to optimize it with the proper co-administration of vitamin C. Dr. Klenner had a little expression that's kind of neat. I'll read it for you. He said, and I quote, ascorbic acid is the safest and most valuable substance available to the physician. Many headaches and many heartaches will be avoided with its proper use. Intravenous vitamin C dose. I sort of alluded to this. If you want to put it into formula, if you will, the only limit on giving it intravenously is as long as you have veins that are large enough to use. So at whatever point in time the infant or the baby becomes a large enough child to allow an IV to be started, that's fine. But I got to tell you, unless you're dealing with a life-threatening situation, the intramuscular works really well on small kids too. So that can be an alternative that's a whole lot easier to go to than trying to struggle with a toddler with an IV. The basic formula, 1 to 1.5 grams per kilogram of body weight. How quick do you do it? Well, how clinically stable is the patient? Do they have a systemic disease or a localized disease? Is it an acute infection? Is it an acute toxin exposure? Is it an acute illness? Does the IV hurt? Let me say this. When an IV hurts, change the IV, discontinue it, putting it in another vein, because you should never fibrose or trash a vein with vitamin C. And if you're getting a lot of pain, relieving the pain with Procaine is not stopping the damage, it's just stopping the pain. So you're just going to assure yourself of having a comfortable trashing of an important vein. You restart it, you use a larger vein if possible. Oftentimes, this is a technical point, but one that gets overlooked a lot. When you have your vein and you stick your IV in then, and then you see that you have good blood return, you're clearly in the blood in the vein, and every time you start a little bit of vitamin C, it hurts. A lot of those, the catheter is in the vein, but directly pressing against the vein wall. There's no way to deal with that other than to discontinue it and start it in another spot and try to take a lower angle so that you go coaxial. Then you have a nice pain-free. Smaller women with smaller veins, pretty much the smaller the vein, the more likely you're going to have discomfort. Remember that the temperature of the blood is about, 98 degrees, give or take a degree. The closer, in very sensitive patients, not as a general rule, but in very sensitive patients, the closer you can get to body temperature, the less discomfort you're going to have. How do you do this practically speaking? Well, when you're using the IV bag, before you add anything to the IV, again, in the very sensitive patient, not as a general rule, you get a big pan of water, you get the water as hot as you can in that water, you throw the bag in there for 10 or 15 minutes. Get the temperature up to 80, 85, 90. Then before you add the vitamin C to the bag, not after, because you do it after, you're just going to accelerate the degradation of the vitamin C. So before you add it, then you take the vials of vitamin C and do the same thing in hot water. And then you got to be ready to rock and roll. You don't want to add the two and then let the bag sit there for a half an hour, 45 minutes. You want to add them and start the IV. And that will often give you a great deal of comfort. And if it's a comfortable infusion without anesthesia, you're not aggravating the vein. Now, something I stumbled across that this was gratifying. I got to say this was gratifying because this was one thing in my life where I reasoned it out before I did it. And it turned out the reasoning was correct. Well, when you start doing a lot of IVs, especially on patients with infections but large cancer loads, and when I say large cancer loads, I mean they have physically a lot of cancer, large mass. I mean they have a pound of tumor rather than 5 grams of tumor, okay? And they have a tumor that's exquisitely sensitive to the vitamin C so that the vitamin C easily kills it. So what happens then when you give an IV to a person with a large tumor load and the tumor is very sensitive to the vitamin C and dies and kills off quickly? You release a ton of pro-oxidant debris into the blood. When the cancer cell lyses, you literally get a rush of pro-oxidant metabolic byproducts and a lot of iron. Now, we all have to deal with fairly practical things in our practice. And by practical, I mean, if you don't make the patient comfortable, they're not coming back. So you lose a patient and somebody extremely sick never gets the proper treatment that they need and deserve. So point being is you can't avoid somebody feeling uncomfortable, but if you follow what I'm going to tell you, you can almost have them always leaving the office feeling good. And it's what I call mop-up IV vitamin C. There's some formulas in here, but the formulas aren't nearly so important as the concept because you can manipulate the parameters of the formula. Let's say you're giving 50-gram infusion, and after half the bag is in, the patient is feeling like garbage. You've killed a lot of cancer cells. You're getting a huge, I don't like this expression, but it's out there, Herxheimer-like response. That initially came from treating syphilis with penicillin, and that's certainly not what we're doing here. But the concept is true because if you kill a lot of pathogens, including syphilis, you release a lot of pro-oxidant debris into the blood. So in this case, let's talk about cancer. So you give 25 grams, and your patient's really feeling lousy, and what do? Well, a number of possibilities. You say you got 25 grams to go. You either you stop the IV first for about 10 or 15 minutes, or run it very, very, very slow just at a keep open rate. And then you follow up with 1/2 to 1/4 of the vitamin C dose that caused the reaction in a larger amount of fluid. So you're still giving vitamin C to resolve the problem that the vitamin C caused. Why does that work? Well, when you continue to give a very slow infusion of very dilute vitamin C, you're no longer getting a lot inside the cells or inside the cancer cells, causing a detox or causing more cancer cells to kill. You're just circulating vitamin C in the blood and neutralizing the pro-oxidant debris that was released. And boy, do they feel better after an hour or so, and then they're ready to come back. So you follow high dose and fast by low and slow. And like I said, there's not a magic formula to it. If the patient is still feeling lousy, well, you go with a lower dose and you go with a slower infusion, but they will feel better. So, something I put together some time back, and it goes along with all these parameters we're talking about getting a score-based saturation inside the body. It's the multi-C protocol. Like I said, I'm sure Klenner and Pauling and everybody else would have used liposomal C if they'd have had it, but they didn't have it. Well, we have it. So in the case of a multi-C protocol, when you're not getting your optimal response to highly dosed one form of vitamin C, you highly dose as many different forms as possible. The rationale is oral liposome encapsulated vitamin C, you're getting a lot directly inside the cell. You're getting a lot directly inside the important immune cells that circulate around the gut, because about 70% of your immune cells are directly enveloping your GI tract. And also, when you don't want to overload a renal insufficiency patient too much, not that much of an oral liposome dose passes through the kidney. Instead, most of it gets inside the cells. So that's different from an IV, where you're going to get a large amount in the blood, and you're going to get a large amount excreted out through the kidneys. How much of the oral liposomes do you use? Well, anywhere from 1 gram or 2 to 50 grams. You can give very, very large doses for a long time. I just assumed that there wasn't any point in going above 5 grams of liposome encapsulated vitamin C. Just my own gut feeling, what reacted to me, this, that, or the other. And since then, in the past year or so, I've had a lot of physicians come up to me at medical conferences, and you say, whoa, you know what? I said, I started this cancer patient on a box a day, 30 grams of the liposome, and you won't believe how well they're doing. So you just leave it out there as an option. It can get a little pricey when you do that, but it's not nearly as pricey as an IV. You know, 1 box of the Live-On product is still $30. What's one IV? $150 to $200. So, oral liposome encapsulated, and something that gets glossed over, and we're finally refocusing on that, is doing bowel tolerance doses of sodium ascorbate on a daily basis, okay? Now, somebody determines what their bowel tolerance is. I mean, you just take a few teaspoons until you have the loose diarrhea, and let's say it's 4 teaspoons that does that, so that's about 16 grams. Well, then, what you do on a regular basis, that patient, is you take a level teaspoon 3 times a day. So that'd be like about 12, 13, 14 grams once 3 times a day, and that way you get the largest consistent dose of oral vitamin C without causing the diarrhea. Now let me say this, the diarrhea is still an option. I personally did a C flush daily for several years. It's a good way to keep your gut clean, and if you're not turned off by being on the toilet 3 or 4 extra times in the morning, it works out great. But some people, they just think the most disgusting thing in the world is spending extra time in the bathroom, so that's their choice. So if they do that, you still go. But the important thing is, with these multigram doses, you're taking them several times a day. The liposomes are sort of like a long-acting form, okay? Not the powder. And now what else happens with the powder? At the same time, you're getting a maximal amount of sodium ascorbate that your body can absorb by that mechanism. You're promoting increased motility of the gut so that you're going to be more prone to have a bowel movement, not less. Even if it's not diarrhea, you're going to be moving more. And you're neutralizing the toxins of poor digestion before they get absorbed. Very, 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 very big factor. So liposome encapsulated, sodium ascorbate powder to bowel tolerance, and then you can throw in a couple grams of a form of vitamin C called ascorbyl palmitate. It's fat soluble. So all these other forms are water soluble. When you take a specially designed fat-soluble form of vitamin C, a lot of it gets taken up into the cell wall membranes of your body, which have a high fat content, and you give added vitamin C protection there. And then finally, intravenous as often as you can get it and afford it. So to wrap it up, let's see. We're in Philippines. I don't know how familiar you are with Mark Twain. He's one of our more sage philosophers in years past. Well, Mark Twain had a saying where he said, "Be careful in reading health books. You may die of a misprint." And I think if Mark Twain knew what we knew about medicine, he might modify that statement to say, "Be careful in reading health books. You may die from something printed as intended." So ignorance as well as misinformation is often deadly. So thank you. See you this afternoon.